Have you noticed that the US government only just started saying that the general public does not need and cannot benefit by the use of surgical masks after we found that we would not have enough masks for the general population and that the coronavirus would be in the United States? So here is the question for you. Do you trust those statements? Maybe we should look a little bit further into the matter. First of all, I've heard a lot of people laughing at various other country people wearing this and that weird kind of masks that were obviously not N95 masks, which are the masks that the US government has said are the only ones that would be effective. Okay, so are N95 masks really the only ones that would be effective? Here's some actual research on the subject. Principal findings: all types of masks reduced aerosol exposure, relatively stable over time, unaffected by duration of wear or type of activity, but with a high degree of individual variation. So for this research, personal respirators were more efficient than surgical masks, which were more efficient than homemade masks. But what they're saying here is that even over a long-term use, wearing masks did aid with limiting aerosol exposure. So the party line that we've been hearing that you have to have an N95 mask was not verified in this particular research, was 2008. All right, so this is a different one. They compared N95 respirators with medical masks, which are just other kind of surgical masks, but they're not N95 extra fancy ones. And they found no significant difference in the incidence of laboratory confirmed influenza. So here they're comparing those two kinds of masks, and they've both found them to be about the same. So again, N95 masks were not found superior in this case, whereas this other research, they did find N95 masks superior, but they also found homemade masks and other options still were useful. All right, so according to most of the research I was finding, any kind of homemade, pretty much decently made mask, even homemade, still has use. It may not be as good as N95, it may be as good as N95, but it was still effective. Okay, so let's talk about how far the flu virus can spread. This is an interesting one because I have found information anywhere from a few feet to 6 feet to 26 feet. It's all over the map. Do we not know this after all these years? You think we would. All right, but that's just for coughing and sneezing. But this research here says even just breathing without coughing or sneezing is enough for a person with the flu to spread the virus. All right, so something to think about. Even if somebody's not coughing, if they have the virus, they can still spread it. All right, how far can they spread it? This one was for coughing and sneezing. One brave group at MIT discovered that the biggest droplets from a cough or sneeze can travel 2 meters, so that's about 6 feet, about the distance between your desk and 2 desks down. But most other droplets, those travel much further, little tiny droplets, up to 8 meters. I think that's about like 26 feet. That's about 5 desk lengths. Not only that, the germ-infested cloud is less dense than the air around it, so it rises upwards, right to where ventilation systems and other people's unsuspecting noses and mouths await. And even though these are relatively smaller droplets, they're probably still teeming with harmful pathogens, blah, 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 blah. Okay. How long can the flu virus survive on surfaces? This is another one where I'm finding information all over the map, anywhere from a half hour to 9 days. All right, so they're talking about the flu virus here has been found to survive for 24 hours on a steel surface. If you touch that surface and don't wash your hands before eating, you may have just gotten infected. Okay, so this one says 24 hours. But again, like I said, it's been all over the map. Do we not know this yet? Is this information so hard to discover? Put a virus on a surface and see how long it lasts. Apparently, we don't really know this. All right. Are surgical masks or N95 masks effective? All right, there are varying studies on this. One study they assigned to schools, they assigned students to two groups, either to wear masks or they didn't wear masks. They were also instructed to wash hands regularly. The results showed that those who wore masks in residence halls and practiced good hand washing reduced their risk of flu-like illness by astonishing 75%. Now, there's been some other research here and there that found that hand washing alone didn't really help that much, and wearing masks alone didn't really help that much. So I don't think you can absolutely be sure that those are totally accurate, but there is research to suggest that doing the two in combo are quite effective. So again, this is research that I say indicates that wearing masks could well be effective. And these are just regular people who weren't sick trying to not get sick. They weren't people already sick trying to block it from other people. So this particular research, I think, fits more with what the general public might be dealing with the COVID-19 virus. Okay, so what about another story I've been hearing is that, don't bother with masks because they're single use. And you should just throw them out afterwards, other than they're no good. And I do not find that. Even I have some of those N95 masks because I use them for sanding and other things before the virus even broke out. And it doesn't say anything about single use on them. So I find that interesting. They are disposable, but they are not single use. They're not marketed as that. Okay, so this research was looking very interestingly about pandemics and this exact situation, but this research was done some time ago, so it's not this year. And they were looking at our situation, basically, if there was a pandemic of some kind of virus and masks would be in short supply, can you reuse them or use them longer term? Okay, so what they're suggesting here is that yes, you can use them longer term, 8 hours, maybe longer. And it's going to depend on if you get a lot of contamination of the mask or not. So what they're suggesting is that you not touch the front and you do a lot of hand washing and you try not to get direct contamination. Now these masks are used in, this research was basically designed for the medical industry. So they're assuming that people are going to be coming into regular contact with contaminated individuals. And so they're saying minimize unnecessary contact with the respirator surface, make sure you wash your hands, try not to get too much germ contamination directly on you. Extended use alone is unlikely to degrade respiratory protection. However, healthcare facilities should develop clearly written procedures to advise staff to discard any respirator that is obviously damaged or becomes hard to breathe through. So yes, they're not single use. These are not single use. That is inaccurate. It's been spreading around. So many weird things have been spreading around that are even said by the U.S. government that, from my research, do not correspond at all to the actual research, which I find is very suspicious. All right, so this is another one. How long can the virus stay on surfaces? Now, this one is specific to coronaviruses, which is interesting. They're saying that coronaviruses like SARS and MERS can survive longer on surfaces than the average flu virus, can remain infectious on inanimate surfaces for up to 9 days at room temperature. However, they can quickly be rendered inactive using common disinfectants and may also dissipate at higher temperatures. It is not yet clear whether the new coronavirus is similar. On copper and steel, it's pretty typical. It's pretty much about 2 hours. How long the coronavirus may be active on those type of surfaces. But I will say on other surfaces, cardboard or plastic, it's longer, and we are looking at this. All right, so again, this is the Japan Times. Seems to be a little bit more accurate than the United States government. So again, I would suggest that you not blindly accept what the U.S. government is telling you on this. I don't know what's going to happen with COVID-19. It may not be that big a deal, but I do think that we should have the accurate information And from what I'm seeing, that is not necessarily coming from the United States government right now.